Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Welcome back. Today we are going to talk about a special type of grafting called sinus lifts.
Yes, or sinus grafting. And this relates to people who have been missing molars, upper molars, or who have had missing upper teeth for many, many years.
Yes.
And very, very often when we are talking about replacing teeth with implants, we have to consider grafting, which is like adding additional bone, because sometimes you need additional bone to encase the implant completely. But in this particular area of the mouth, in the upper back molar area, there is a sinus that we have to deal with, the maxillary sinus.
Right. So sinuses are air spaces that we have, and the maxillary sinus kind of sits sort of behind your cheeks, right? And it's above where your teeth are, the roots of your teeth.
Yeah, and very often the roots of your teeth actually go into the sinus floor. So it's very intimately related to the roots of the upper teeth.
Right, because the connection or the membrane between the sinus floor and sort of the top of the roots of your teeth is just like a thin tissue.
Yeah, it's basically like an eggshell bone, and then the little, like if you ever try to crack a raw egg and you just try to peel the shell off without breaking that little membrane so the egg doesn't spill out, that's kind of like the sinus membrane.
Right.
It is very thin, but it's got some consistency, but also it's very easy to penetrate.
To break through.
Yeah, to break through.
So when you are missing a tooth, so when you have a tooth extracted, you lose bone. So we lose bone in the upper area in three directions, right? You can lose height of bone, so the bone kind of drifts up. You can lose thickness, especially from kind of the cheek side.
It goes in.
And
And that's why people get that kind of like caved in look sometimes when people don't have any teeth. Their whole upper jaw kind of caves in.
so all the bone is kind of receding.
Everything's just like constricting.
And then in the upper molar area, you also have a third issue that can arise, which is your sinus can kind of drop down into the space of the bone.
Yeah, so the airspace just becomes bigger, basically. And the body is really amazing. It's so efficient. It won't, like if you don't have teeth, it doesn't put bone there because you don't need it. You don't need it, you know? So if you think about it, it's like a super smart use of resources.
But you just have to tell it, listen, I want to put an implant in there.
Wait a second, body.
Keep this bone.
We need the bone now.
Right.
So
that's where we come in.
Yes, so that's where grafting comes in. So we need to add bone. We need, especially if you've been missing the teeth for a long time.
Sure.
The bone really can shrink away. So let's talk about some of the specific things that can happen in this area, because in other areas of the body you don't have a sinus. So things can be a little bit different in the sinus area.
Okay.
So first of all, let me just say that sinus bone grafts are very, very successful. Because why? Because you have an enclosed space, and once we close it, it's hard for bacteria to get in there, and the bone can just grow so easily. But also remember, I said you have a very thin membrane and it's easy to perforate. So sometimes there's perforations, and some people really freak out because you can get like bleeding from your nose like for a day. But the sinus can close itself very quickly too. So it's like a little gelatinous membrane that can like quickly close. So it's both very successful, but also easy to kind of perforate, and things can spill into the
honestly,
sinus.
probably if you ever have an upper molar extracted, there's a high chance that there's a small micro perforation of your sinus, because they're just sitting up there. And unless it's like a big hole, we don't repair it. We aren't even aware that there might be a perforation, because your body will just heal that over.
Yeah, most of the time we don't know that there's a perforation, and like I said, most molar teeth and upper wisdom teeth, you probably are going to have a microperforation. But like you said, like you don't even notice because all the blood and, like PRP and all this stuff can actually close it, and then you just heal. So
but this is one of the reasons, if you've had an upper molar extracted, your dentist has probably said to you, try not to blow your nose, pop your ears, drink through a straw, things that cause pressure in your mouth, because we know that membrane is really thin, and now that it's kind of exposed to your mouth, there's a chance that you're going to pop through that, right?
Right.
So that's one of the reasons why we tell people that.
Exactly. And we want that blood clot to be stable, right?
Yeah,
so we don't want to like keep taking the blood clot out. For the upper sinus grafting, let me just go through the steps of how it goes. So typically we try to place the implant at the same time as we do the grafting. And the grafting can really vary depending on how much bone you have left. Like if you just have like a tiny little sliver of bone, you may need to even do like multiple series of grafts, right? But if you've recently had the tooth removed and maybe you don't have enough height, like typically we need about 10 millimeters of bone height. Anything less than 8, I would say we really think about grafting into the sinus.
Right, because typically the smallest size, regular sized implant is 8 millimeters long.
Right.
And that has to get embedded in bone fully.
Exactly. So typically, anything less than 8, like once you're like 6'4", we definitely think about grafting into the sinus. And we use the implant kind of like a tent pole. Like if you want to think about that membrane as like the fabric of a tent, and you put an implant, now you're holding up that tent. Now you have this space around it, and there we put PRP. And we've talked about PRP many times.
Yes.
But it's basically plasma from your own blood. We pack it all around that. And now you have this beautiful enclosed space. There's bone that forms within that tent.
You're just creating space for the bone to fill in.
You're just creating space for the bone to fill in.
You're tricking your body, telling it, hey, there's a tooth here.
Exactly. Hey, there's a tooth. There's PRP. Come, create bone.
So, okay, perfect. So you create a tent pole. Now, this works well because then you're going to close that right up. And one of the main reasons that grafting or any kind of surgery, one of the side effects is infection, right?
Yes, and one of the main causes of infections in grafts is that there is some kind of bacteria infiltration, right? So we need to make sure the gums are completely closed and sutured up, so everything is as closed as possible. And if you can imagine within this enclosed space of the sinus, how nice and controlled it is compared to other parts of the mouth where you're talking, you're moving, things are wobbling around, and we're trying to keep the gums closed. Whereas in the sinus, there is really no movement. It's pretty enclosed. I mean, unless you're like really blowing your nose or doing yoga and going upside down.
Just thinking about that patient who did yoga.
Doing crazy stuff. Like just keep it still. It's already pretty enclosed. It's its own space.
Yes.
So it can be very, very successful.
So there's 2 ways really to do sinus lifts. There's 2 approaches, right?
Yes.
So when you are just trying to lift the sinus in one area a small amount, then you can do a sinus bump.
Yes, so there's the Crestal approach and the Lateral approach.
Okay.
So the Crestal approach is when we don't kind of like go, so let's just talk about the lateral approach first, because I think that's what most people think about.
Yes.
So the lateral approach is where we go from the side of the cheek, and we actually open a little window on the side.
Now this is inside your mouth, not through your cheek.
Yeah.
But if you like lift up your lip on the side, and then that bony ridge that's on the cheek side of your upper jaw.
Everything we're talking about is inside your mouth.
Yes.
And we actually open a little window, and we remove a little piece of bone.
Like a rectangle of bone.
Like a rectangle of bone. And now we have that little membrane, right? We have that beautiful membrane. Now we can gently lift that membrane up. And then, like I said, with the implant, make like a little tent pole.
And pack some bone in between.
Yes, and
so
PRP.
From the lateral window, we are putting PRP and possibly bone.
Yes.
Right? And we're trying to lift up this tissue off sort of the top of the bone that's existing there.
Yes.
Okay.
And then we put the little triangle back and we suture it up. That's kind of like the gold standard up, because you can really see everything that you're doing. If there's a perforation, you can repair it. Whereas the other approach is called a Crestal approach. That approach is basically where you take out the tooth, and in the hole that's left of the tooth, you go and you pack bone and bone and membrane to push that sinus up, but it's as if you're pushing it up from where the end of the root of the tooth used to be. So you don't have as much visibility. It's way more tactile feel. And you really need to rely on your CT scans and your measurements
to see how much to add, how far up to go.
Exactly.
It's kind of like being in the house and raising up the ceiling from within your house. You're just pushing it up, versus the lateral approach is you're going into the attic. I don't know
this analogy. I don't know. But
you're on the side.
But when you get way more visibility, those really are where you want to add the most bone. If you only need 1 or 2 millimeters, if you have 8 millimeters of bone and you need 1 or 2, very often we don't do that whole window, because every surgery, has its consequences, right? The more invasive the surgery, the more post-op swelling and pain and all this kind of stuff. So we don't want to put our patients through unnecessary post-op swelling. So sometimes, we have to kind of decide, do we want to really go and open the window, or can we just go from where we took the tooth out?
And generally, if you're doing the Crestal approach, where you're just bumping it up, you're placing the implant. So it's one surgery usually. Sometimes the lateral approach is multiple surgeries. So that's another thing. You save yourself having to go through something like this twice. But generally, it has to do with what's going on in your mouth. So if you are just getting a tooth pulled and you're going to have an implant placed, often the sinus bump, the sort of going from the Crestal approach, can work, because you already have some bone surrounding potentially that tooth, and maybe you just need a little bit more height. But if you've been missing your molars or molar for a while, then it's more likely that you've lost kind of more bone than just a little bit, and then you have to do the lateral approach.
And if you've lost multiple molars, right? Because the sinus actually follows the molar, so it can have height and then not, and then again, depending on where the teeth are. So if you have multiple teeth missing, it really loses the bone height quickly.
Often it's, with people who've had their molars missing for a very, very long time, sometimes it's very hard to get enough bone in that area.
Because you just have a thin eggshell of bone. And it's multiple, grafting and surgeries, and sometimes there's just not enough bone, no matter what we do.
It's not doable. If you are going to get a molar taken out, and you're planning to get an implant, so there's another kind of grafting which is called a socket graft, right? Or a ridge preservation graft. So often when you have a tooth pulled but you're not ready to get an implant, we'll clean that socket, that hole that's left, and pack a bunch of bone graft in there. And it's like a placeholder. It's going to hold that bone, because you have sort of bone all the way surrounding the hole. So we're just kind of packing it in there.
But and it'll again, it's temporary. It's temporary. Your body again is going to notice, hey, there's no tooth here. So even that graft can resorb.
But it'll buy you some time.
It'll buy you a few months.
You lose what, about 20% of that bone per year or something like that?
It'll buy you a few months, basically.
It'll buy you a few months. So you really want to plan to get that implant within the year, because you're going to just lose a percentage of that bone, basically, over time. But it'll buy you some time. So often when we're pulling teeth, where we're potentially going to place implants, we're going to pack bone in that area.
And also, maybe the most efficient way to preserve bone is immediate implant placement.
Got it.
But that can't always happen, depending on infection and just the anatomy of how much bone you have left. Is there even enough to place the implant? But if it is possible, that's probably the most reliable way to maintain as much bone as possible. Because now you're really telling your body, hey, the tooth is gone, but here's an implant, right away. And then, again, we pack bone all around it. we still graft, but now we have the implant to like really hold everything up for us.
Yeah, perfect. Your tent pole is already
tent
there.
pole is there, yeah.
So, criteria for that is lack of infection. So if you like crack a tooth, let's say, it's not necessarily an infection, but the tooth needs to go.
Yes.
That's a good opportunity to place an implant at the same time.
Yes, or if you had a tooth that has had like multiple root canals and the crown keeps falling off and there's just like nothing left to put a crown on, the tooth is not infected, but it's just like not restorable, we say.
Yes.
So then we would just take it out and then put the implant right away.
Sure.
And now you're really giving the implant really a good chance because you have the width, you have the height, you have all the dimensions of the bone that you want. You place the implant, you still graft around it. And this is kind of like the best way to trick your body into thinking, hey, there's something else there now. Let me have some
maintain
bone
my
there.
bone.
Yeah, exactly.
Yeah, good. So, I mean, that's important. So if you're thinking about future, even if you don't get a crown on it right away, just having that implant body embedded in the bone is super helpful to keep your bone.
It is.
Yeah.
It is. Well, if you're missing teeth or have any questions about grafting, you can always do a free virtual consultation with us on our website, and we look forward to seeing you next time.
Bye.
Bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.